Welcome to the module Smoking Safety for Patients, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about assessing smoking safety and what to look for to provide patients and residents with tips on how to smoke safely. What you know and how you use that information improves the quality and safety of the patients you care for. This learning module is part of a series of modules exploring tobacco use and cessation that are helpful in providing best practices related to tobacco use. You are viewing the second module of the series, which provides you a general overview about smoking safety tips across various settings. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of these modules at any time. The objectives of this module are to understand smoking safety tips for various settings, review how to assess smoking safety and motivating patients, and examine best practices for smoking safety. According to the Centers for Disease Control and Prevention, only 15.5% of the adult population were current smokers in 2016 compared to 33.2% in 1980. Despite today's comparatively small percentage of smokers, smoking remained the leading cause of home fire deaths from 2012 to 2016. Smoking materials, including cigarettes, pipes, and cigars, started an estimated 16,500 home structure fires reported to U.S. fire departments in 2016. These fires caused 660 deaths, 1,060 injuries, and $372 million in direct property damage. Smoking materials caused 5% of reported home fires, 23% of home fire deaths, 10% of home fire injuries, and 6% of direct property damage. The increase of indoor smoking bans has been accompanied by an increase in home smoking material structure fires that began outside. The leading area of origin for home smoking fires in 2012 to 2016 was an exterior balcony or open porch at 18%. The place where people feel the safest, at home, is where most smoking material structure fires, deaths, and injuries occur. Smoking materials are the leading cause of fire deaths and are preventable. As you work with patients or residents who may smoke in or around their home or residence, here are some smoking safety tips that you could communicate to them. Smoke outside. Many things in the home can catch fire if they touch something hot like a cigarette or ashes. It is always safer to smoke outside. Put cigarettes out all the way. Do this every time. Don't walk away from lit cigarettes and other smoking materials. Put water on the ashes and butts to make sure that they are really out before putting them in the trash. Be alert. Do not smoke after taking medicine that causes drowsiness. This could cause issues with preventing or escaping from a fire. Never smoke around medical oxygen. Medical oxygen can explode if a flame or spark is nearby. Even if the oxygen is turned off, it can still catch on fire. Never smoke in bed. Mattresses and bedding can catch on fire easily. Do not smoke in bed because you might fall asleep with a lit cigarette. Put cigarettes out in an ashtray or bucket with sand. Use ashtrays with a wide base so they won't tip over and start a fire. And lastly, consider using a smoking apron. It is important to conduct an environmental risk assessment whenever oxygen will be in use to ensure a safe environment that is free of potential ignition sources and has appropriate response equipment in the event of a fire. Oxygen is a safe gas and is non-flammable, however, it supports combustion. Materials burn more easily in an oxygen-enriched environment. Be prepared and ready for the oxygen that will be in use. Ensure there are operational smoke detectors, fire alarms, and fire extinguishers, including a maintenance plan for all items. If oxygen is used in various rooms in the house, more than one extinguisher may be needed. Can the patient demonstrate how to use a fire extinguisher? Maintain a clear, uncluttered evacuation route in the event of an emergency, or if emergency responders need access. Does the patient know their escape route options? Losing access to oxygen can be very dangerous if you need oxygen continually. Make sure to have backup equipment. Alert local fire rescue and the utility company of oxygen use to expedite power restoration should an outage occur. Consider buying a backup generator in the event of power outages. Be sure that oxygen cylinders are stored upright and secured. Don't store oxygen in an enclosed space like a closet or trunk. Smoking presents significant hazards when oxygen is in use. While smoking cessation is ideal for eliminating these risks, it is not always feasible. It is crucial to have controls in place for residents who continue to smoke in hospice, home health, and assisted living settings. The first step is to assess residents upon admission regarding their smoking history and habits. Develop and disseminate written policies regarding resident smoking that includes guidelines on resident behavior. Identify designated smoking areas in the residential setting and ensure the areas are free from clutter, away from electrical panels and outlets, and away from resident or pedestrian areas to minimize inhalation of secondhand smoke. Identify those individuals who require supervision when smoking and limit their access to cigarettes, matches, and lighters. Assess their function and ability per organization policy and procedure manual. Prohibit oxygen use in areas where smoking is allowed. In order to have a complete picture of a person's smoking habits, an assessment needs to be done to determine if there are any safety risks. This slide outlines questions that can be asked during an assessment. Is the resident physically able to smoke and extinguish the cigarette in a safe manner? Does their range of motion allow for safe smoking? Is the resident able to make safe smoking decisions? Is the resident aware of how, where, and when to light and extinguish a cigarette in a safe manner? Is this resident able and willing to follow directions related to how and where to smoke safely? Is this resident able to safely ignite a lighter or matches without risk to themselves or others? If the resident uses oxygen, will they remember to turn off their oxygen or remove their oxygen completely when smoking? Have you explained that smoking in their room is unauthorized and that smoking must occur only in designated areas? Do they understand and will they remember where the designated areas are? Can this resident and will this resident use an ashtray safely? Can this resident and will this resident hold, store, and manage their cigarettes and their lighter or matches in a safe manner that won't threaten themselves or others? Based on the results to your questions, you should be able to determine if the resident is able to smoke safely without assistance, must be observed at all times while smoking, or if the resident's cigarettes and lighters should be kept by staff to ensure safety. Please review these references for additional information regarding smoking safety and smoking assessments. Congratulations! You have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Smoking Safety for Patients quiz on the Frontline Forces webpage or in the YouTube description below. This material was prepared by the Superior Health Quality Alliance under contract with the Centers for Medicare and Medicaid Services, an agency of the U.S. Department of Health and Human Services.